Hello, this is Dr. Maryam Lusberg, Chief of Breast Oncology at Yale Cancer Center. Today I'll be covering updates on the use of immunotherapy in early-stage breast cancer. So first, I would like to discuss the important findings of KEYNOTE-756. This was an important study of 1,278 patients with high-risk hormone receptor-positive breast cancer. High risk was defined as having grade 3 disease, having a tumor that was greater or equal to 2 centimeters, and having lymph node involvement or having a larger T3 or T4 tumor. These patients were randomized to traditional third-generation chemotherapy that included anthracyclines and taxanes versus having that same regimen with the addition of pembrolizumab. The findings were striking in that the complete pathologic response rates were 24% in the group that had the addition of pembrolizumab versus 16% in the group that did not. Additional analyses on subgroups showed that the group that benefited the most were the tumors that had low expression of hormone receptor positivity at 10% or less, and tumors that were PDL positive. When we looked at PCR rates in those groups, the rate of PCR was as high as 58% with the addition of pembrolizumab versus 33% without. So this study raises important questions about the role of immunotherapy in high-risk hormone receptor-positive breast cancer. Additionally, it raises questions in terms of what happens after surgery in this population. We still need additional safety data in terms of the combination of CDK4/6 inhibitors with immunotherapy. So these are all unanswered questions. However, in summary, I think the trial has important findings about a subset of high-risk hormone receptor-positive tumors that actually can benefit potentially from the combination of chemotherapy plus checkpoint inhibitors. The adverse event rate was a bit higher in patients receiving immunotherapy, again highlighting the need to select carefully for the patients that may need more intensive therapy versus those that do not. So I do believe that additional studies in the future, as well as additional correlative studies from this study, will help further clarify these questions.